The American Cancer Society says skin cancer is the most common of all cancers in the U.S. And while melanoma accounts for only about 1% of skin cancers, it causes a large majority of skin cancer deaths. But a new clinical trial using mRNA technology to prevent melanoma cancer reoccurrence is now underway.
According to the American Cancer Society, skin cancer is the most common type of cancer.
Experts are now lowering the age for when women should get them. The U.S. Preventive Services Task Force is now recommending women get a mammogram starting at 40 years old instead of 50. It is a shift from their guidance back in 2016. But now it's in line with the screening age the American Cancer Society.
We're celebrating Men's Health Month, and one of the biggest stigmas is prostate cancer.
Yeah, so the prostate is a gland that sits below the bladder. It's the most common cancer in men, the second leading cause of death from cancer in men. And oftentimes there are no symptoms for prostate cancer, which is why screening is so important.
I think the biggest thing really is going to the doctor. You have to have that conversation to make sure that you are doing the right thing. The PSA test is an important test. It's certainly not, it doesn't tell you everything though, right? It's important to have it to set that baseline, like Dr. Patel talked about. And if it does start to elevate, that's when you're looking at treatment.
The American Cancer Society is looking for volunteers to give rides that save lives right here in Oklahoma City.
Cancer, you have so many things to worry about and to stress you out. And getting a ride to your treatments should not be one of them.
The American Cancer Society is looking for more volunteers for its Road to Recovery program.
This program provides patients with free rides to and from their medical appointments that are cancer related, eliminating transportation barriers as they seek these life-saving treatments.
Well, an estimated 2 million people nationwide will be diagnosed with cancer this year. Imagine that. It's a hard number to swallow, but you can help those patients in your community in a very simple way.
American Cancer Society Road to Recovery provided 1,400 rides last year, and it fell short. We only have 137 drivers, so any way you'd like to give back, think about you have friends and family that you're unable to make a difference maybe in their cancer journey, but you have friends who need help. And so It's super easy to go to cancer.org/drive and sign up. There's an hour of self-paced training. There's a background check, and as long as you have a vehicle and a safe driving record, you can be a driver.
The reason I decided to volunteer with Road to Recovery in particular, in large part, is I'm a breast cancer survivor, so it does hit near and dear to home. And I felt it'd be a great opportunity to give back to some others in the community that are in a similar situation and need some transportation rides to and from appointments.
Okay, so tell me a little bit about this Road to Recovery program.
Well, so it works a lot like Uber, except all the drivers are volunteers and the rides are free to the patients, and the goal obviously is to save a life. I've been volunteering with the ACS in a variety of ways over the last probably 5 or 6 years. So what I came up with was to hop on my bike and start riding around the country and raise awareness for this problem and see if I couldn't find some drivers along the way.
The American Cancer Society is helping cancer patients get to and from their doctor's appointments through a program called Road to Recovery.
The American Cancer Society is hoping to add about 8 new drivers this summer.
And for Robin, she wouldn't want to spend her free time any other way, because for many cancer patients, it's their only way to get on the road to their recovery.
Okay, thank you. Want to say thank you to ACS because they've always been there.
Just some of the sights and sounds at the 2024 Couture for a Cure Style Show hosted by the American Cancer Society's Cattle Barons Ball Corpus Christi chapter.
We are celebrating the caregivers of cancer patients, cancer survivors, and those who we've lost to cancer.
The
second annual Cancer is a Drag event is just around the corner, and you can help raise money to get people the care they need.
Last night, lots of folks partied with a purpose as our Take 5 to Care partners in the American Cancer Society held the second annual For Cancer event.
This event, I hope, brings awareness to that cancer is not something that just happens to a specific person. It can happen to you if you're young. It can happen to you if you're older. And, you know, just being aware of, you know, what you can do to prevent cancer, what options you have when you are fighting cancer and actively fighting cancer, and knowing what those resources are for you and your community.
Both Roy and Romaine have relied on the American Cancer Society's Hope Lodge as a free place to stay when caring for a relative with cancer who's being treated in New Orleans. Others here bring strength and support.
And we can sit down at a table and talk to one another and learn from one another how we can assist that we didn't think of that they're doing, and we share the same things with them.
The American Cancer Society is launching a groundbreaking study this week aiming to find out why Black women have higher rates of cancer and cancer death.
The American Cancer Society says more than 2 million new cancer cases are expected to be diagnosed in the U.S. this year.
And despite significant strides in cancer research, Black women continue to have the highest death rate and shortest survival of any racial or ethnic group. Mandy Gaither shares details of a new study aimed at changing that.
It's called Voices of Black Women, a new study by the American Cancer Society aimed at addressing cancer disparities.
The American Cancer.
I've chosen to participate. I'm actually an ambassador. I've actually been an oncology nurse for over 35 years, so I've watched this. I've watched over the years how we see Black women come in at the same stage, but their outcomes are so different. So I've watched it, I've taught it, I keep presenting about it, but there's not been one thing to say what is the difference other than we know that this is happening differently for Black women. So women should join because this is an opportunity, first of all, to give voice to something to help to truly make a difference, not only for your health, but the future health of all young Black women